Acetaminophen. You almost definitely know it as Tylenol, or maybe Paracetamol, depending on where you are in the world. It's in just about every medicine cabinet on the planet. And we think of it as, the safest, most basic way to deal with a headache or bring down a kid's fever. But what if I told you that this everyday cure has a hidden and really dangerous other side? Let's get into it.
Now, really, think about it for a second. For so many of us, the answer is a pill with this one single ingredient. It's so common, so trusted that we pop it without even a second thought. But that's exactly why we need to talk about it today. That casual trust is where the risk can hide.
So here's our game plan for this explainer. First, we'll look at why it's the world's go-to remedy. Then, we'll solve the mystery of what it's actually doing inside your brain. We'll ask, is it really the safer choice? From there, we hit the dangerous tipping point, see exactly how an overdose creates a crisis in your liver, and then wrap up with the most important part, how to respect the dose and use it safely.
All right, first up, let's just establish its reputation as the absolute hero of the medicine cabinet. When it comes to pain and fever, this stuff is a global superstar.
And what's so wild is how this one ingredient hides in plain sight. Call it acetaminophen, call it paracetamol, grab a bottle of Tylenol or Panadol, it's all the same molecule. But it's not just flying solo. It's also a key player in heavy-duty prescription painkillers like Vicodin and Percocet, and it's packed into countless cold and flu formulas. Now remember that, because it's going to be really important in a few minutes.
So here's a fun fact. For decades, scientists were totally stumped. They knew it worked, they just had no idea how. So now let's dive into the brain and figure out what's really going on. Okay, this is probably the biggest takeaway here. Acetaminophen is not an anti-inflammatory drug. It's not like ibuprofen or aspirin. Those guys, the NSAIDs, they work out in your body's tissues, right at the site of an injury or swelling. Acetaminophen plays a totally different game. It works centrally in your brain and spinal cord. It basically tells your central nervous system to turn down the volume on pain signals, and it helps reset your body's thermostat during a fever. And that's why it doesn't tear up your stomach or mess with blood clotting. It's in a whole different league.
And that unique way it works? Well, that's exactly why it's so often seen as the safer choice, and why doctors tend to recommend it first.
I mean, it makes sense, right? Because it works up in the brain, it sidesteps a lot of the common problems you see with NSAIDs, it's generally considered safe during pregnancy, it's the go-to for someone with stomach problems like ulcers or acid reflux, it's perfectly fine for people taking blood thinners, and of course, for decades, it's been the #1 choice for parents trying to bring down a child's fever. By all these metrics, it seems like the perfect drug. So, if it's so great, what's the catch? Well, this is where our story takes a pretty sharp and serious turn. Because hiding behind that squeaky clean reputation for safety is a really significant danger.
We've now arrived at that dangerous tipping point. This is the spot where the line between helping and harming gets incredibly, and I mean incredibly, thin.
The key idea here is something called the therapeutic window. Think of it as the safe zone between the dose that makes you feel better and the dose that could seriously poison you. For a lot of drugs, that window is huge. You have a lot of wiggle room. But for acetaminophen, that window is surprisingly and dangerously narrow. It doesn't take that much to go from the right dose to the wrong one.
So how does that happen? Honestly, the easiest way to picture it is as a massive, catastrophic traffic jam happening inside your liver.
Okay, let's break it down. When you take a normal dose, about 90% of it cruises down a safe main highway in your liver and gets cleared out, no problem. A tiny little bit, maybe 5%, gets shunted onto a side road, and there it gets converted into a really nasty toxic substance called NAPQI. But that's okay. Your body has a special cleanup crew, an antioxidant called glutathione that swoops in and neutralizes it. But during an overdose, that main highway gets totally gridlocked. So more and more of the drug is forced onto that toxic side road, creating a flood of NAPQI. Pretty soon, your cleanup crew is totally overwhelmed, they run out of supplies, and then that toxic NAPQI is free to just attack and kill your liver cells.
So where does that overdose even come from? Well, remember all those products we talked about at the beginning? The pain pills, the cold and flu capsules, the stuff for period cramps, even those strong prescription painkillers. It's hiding in all of them.
And now leads us to the single most common reason for an accidental overdose. The question is, are you accidentally double dipping? Maybe you take some Tylenol for a headache, and then a few hours later you're feeling sick, so you take a multi-symptom cold medicine, not even realizing you've just taken 2 big doses of the exact same active drug. And just like that, you're creeping up on that dangerous limit.
Now, what makes this whole thing so scary is how sneaky the symptoms are. On day 1, you might just feel a little nauseous, maybe throw up, or you might feel nothing at all. And And then comes day 2, and this is the most dangerous part. You might actually start to feel better. It gives you this false sense of security, all while your liver is silently being destroyed. It's not until day 3 that the real horror show begins. Yellow skin, confusion, terrible stomach pain. By then, the damage is severe. And by day 4, you're facing a very real risk of total liver failure and death.
So let's get to the most critical part of this entire discussion. How do we use it safely? It all boils down to one simple, powerful idea. You have to respect the dose.
Okay, this is the number to burn into your brain. 4,000 milligrams. That is the absolute maximum a healthy adult should take in one 24-hour period. And honestly, to build in an even bigger safety buffer, a lot of experts are now saying you shouldn't even push past 3,250 milligrams. You have to know your dose. Always, always read the label.
And for some people, that safety margin is even smaller. Chronic, heavy alcohol use is especially dangerous because booze basically revs up the engine that creates that toxic NAPQI, while at the same time, it uses up your glutathione cleanup crew. Anyone with liver problems or even people who are fasting or malnourished are also at a much higher risk because their natural defenses are already down.
Now, the good news is there is an antidote. It's a compound called NAC, and what it does is it restocks your body's supply of that glutathione cleanup crew. But, and this is a huge but, it is a frantic race against the clock. It works best if it's given within 8 hours of the overdose. After that, its effectiveness plummets. And that's why those deceptive early symptoms are so wicked. They can easily trick you into waiting too long to get help.
So after all of this, what is it? Is it a gentle cure or a hidden poison? The truth is, it's both. In the right dose, it is an incredibly effective and safe medicine, but it absolutely demands our respect. The difference between relief and disaster isn't really in the pill itself. It's in our knowledge and the care with which we use it. So the next time you reach into that medicine cabinet, what are you going to be thinking about?